If it's your leg day and you've been sitting at a desk all day, use this warm-up in order to improve your squat. Dr. Nicholas Mercer with uImproved PT. So it's squat day, but you've been sitting all day, whether that's for work, for school, any reason you've been sitting most of your day. That's going to interfere with your squat. It can cause that weight to be distributed to the wrong places instead of the stronger muscles of your quads, your glutes, your lumbar extensors. It can actually go to those joints, and those joints can get a lot of pain if we're not squatting properly and controlling the weight that we are loading. So here's a really good 3-step warm-up process to go from kind of that seated at a desk position to squat ready, to prevent injuries, prevent any pain you may have, and really just make your squat stronger. So we're going to start out with rowing. Now the reason I start out with rowing is because it's a nice bilateral movement, just like the squat is. We are getting maximum hip flexion, knee flexion, and ankle dorsiflexion, right? The key here is maintaining a tall posture, keeping as much of that natural lumbar extension curve as possible, and really heating up the tissues, heating up the muscles. That will make them work better, make them better at contracting and lengthening and basically controlling all your movements. We are getting, again, that range of motion over time, just working into that hip flexion, knee flexion, and ankle dorsiflexion that we need for the bottom of the squat. But mostly it's starting to train that squatting position, that squatting movement pattern in a position where we don't have gravity playing into it as much, because all of those forces and the movements of the joint are kind of happening parallel to the floor. We're not really getting a lot of loading from gravity, and that's really what we want to start out to get all those tissues warmed up. The next step, we're actually going to load our squat pattern with gravity. And what we want to do here first is get a maximum hip hinge. And that's because the first thing you want to do when you squat is get that hip hinge, just a little bit of that hip hinge, and then do the squat. So what I do is I warm up with a full hip hinge. I get maximum hip flexion, making sure I keep that lumbar lordosis or extension in my lower back, and then bringing those knees forward, bending them, and trying to keep as much upright posture as I can. You'll see I move my hands forward for this just to redistribute the weight and get my hips, knees, and ankles used to that squatting position. And then come back up like you're coming out of the squat. Do that again. Hip hinge back as far as you can. Once you go as far as you can, drop down into the squat, adjust the arm position, and come up. Then from there, you can adjust the arm position depending on what squat you're gonna do. I like to go from hands forward to overhead just because it makes me use the muscles that are gonna bring me forward over my heels and not putting a lot of strain on my lower back. So as I bring my arms overhead, those muscles actually have to turn on and activate more in order to keep that position, so that I have that activation and those muscles are basically turning on and letting me know that they're ready to load that squat. And finally, we are gonna load the squat. So we get into the squat rack. Again, with any of the squats, you can use dumbbells, barbell, kettlebells, whatever you're most comfortable with. I really like the barbell front squat. That's just for my body type, for my issue specifically. That's the most comfortable squat for me, so I stick to it. And so what I do, start with the bar, do that squatting motion. So now we're just loading that same squat pattern that we practiced in the previous step, and we're just getting used to lifting weight with it, making sure that our weight is still distributed. We're getting the proper hip, knee flexion, and ankle dorsiflexion, making sure the core, the belly button's pulled in, and we're still getting that normal curve in the lower back, going as low as possible without faulting on those positions, on those joint positions, and then coming up. Over time, adding a little bit more weight until I'm at my working set. Recently, I've been doing sets of 5 to 10. I find that that's a good rep range for me to still challenge myself, still get relatively close to failure, but still stay safe, having no pain, no injuries, and making sure that my form is still the same as it was when I was not loading my squat. So do that warm-up process, that 3-step process, in order to get ready to squat, especially if you've been sitting all day, because that sitting really throws off your squat patterning, and we just want to get everything working the most optimal way that we can, so that we can, again, prevent injuries, decrease pain, and really just be stronger in the squat position. If you continue to have lower back, hip, knee, any of these types of pains when you're squatting, there may be something more significant going on. You may need some actual physical therapy, evaluation, and treatment along with a plan of care in order to finally end that back pain and take control of your life, your physicality, your exercise. And one of the best things to get started is to go to uImprovedpt.com. We've got a lot of free information on ending these various different types of pain that can come with squatting with improper form or with the wrong strength, activation, and mobility. Also subscribe to our YouTube channel for more videos like this, where we help you improve your movement and improve your life.